Today, I'm going to show you some basic wear and care instructions for your child's post-operative helmet. When putting on the helmet, ensure your child is securely seated with their head upright. Place your hands on the front and back of the helmet and gently hinge open. Scoop the helmet on the child's head, ensuring the back of the helmet cups at the base of the neck below the level of the ears. Ensure the front edge of the helmet is just above the eyebrows and the ears are located within the ear reliefs. The helmet may touch either ear, but should not leave any marks. Tighten the straps enough to feel tension from front to back. On occasion, the side seams will not close. So long as the helmet is staying in place and your child's skin is not being pinched, this is still acceptable. Now, let's review how to properly clean the helmet. First, use rubbing alcohol to disinfect the inside of the helmet. Pour rubbing alcohol onto a washcloth and scrub out the inside of the helmet. Next, you will use mild baby shampoo to firmly scrub the inside surface of the helmet. We recommend using baby shampoo that your child has used in the past so that we know that they aren't sensitive to the product. Using a washcloth, wipe away any residue left by the shampoo. Finally, grab a dry hand towel and wipe away any moisture that's left inside the helmet and let the helmet air dry. This can take up to 30 minutes. Never submerge the helmet underwater when cleaning because the foam can absorb the water and take a very long time to dry. Also, never use heat such as a blow dryer to dry the inside of the helmet as this could potentially melt the foam. Finally, make sure that your child's head and hair and the helmet are completely dry before putting the helmet back onto the child. It is very important to clean the helmet well every day to prevent any infection or skin irritation. It is not uncommon for children to sweat profusely the first weeks of helmet treatment. Babies sweat through their heads, and it can take several weeks for them to acclimate to the new helmet. Dress your baby in lighter clothing than you typically would to help keep them cool. On especially warm days, leave the fan or the AC running in the nursery to prevent overheating. Do not leave the helmet in a hot car. If you are going to be outside on extremely warm days, feel free to remove the helmet for a short break. If your baby has a fever, we recommend removing the helmet and treating the fever. Leave the helmet off until the fever has subsided. Redness is normal as long as it goes away during the first 60 minutes after removing the helmet. If the redness begins to subside but does not completely resolve, apply a light layer of petroleum jelly or ointment to the affected area and continue helmet use. If the redness is excessive or you notice broken skin, remove the helmet and discontinue use and reach out to our office to schedule a follow-up visit. If possible, please send a photo to your clinician via MyChart. Your goal should be to have your child wear the helmet 23 hours a day. When the helmet is brand new, begin by wearing it a few hours at a time. Remove the helmet to check the scalp for any major concerns with skin irritation or excessive redness. You may need to sift through the hair to see the scalp below. If redness or irritation resolves, please resume wear. You should have a 1-week follow-up appointment scheduled. At this appointment, we will address any issues that have come up. Minor concerns such as tipping and rotating will be addressed at this visit and should not limit your wean-in schedule. For any helmet-related questions, please feel free to reach out to your orthotist via MyChart.